Hello, hi, this is Dr. Erica, pharmacist. Thank you for joining me. Please like, share, and subscribe. There's a little button that you may see in the corner there that says subscribe. Please click that button so that you can be in the know and receive all of the updated content creation that I put up on a weekly basis, daily basis mainly. I do have other videos that pertinent and relevant to this video, living with allergies. Please visit that video as well. That video just gives a general idea of the allergies, uh, things that cause allergy and things that can be avoided, how to deal with allergies on a seasonal basis. This particular video is going to talk about medications to help with allergies and what to expect as far as side effects, what to look out for, inhalers, things like that. Other disease states as well that could be influenced by allergies. So please visit other videos as well. Like, share, and subscribe. I do have a website called themillenniumpharmacy.com. Themillenniumpharmacy.com is up and running. Please visit their shop. Give any comments that you have. I sell merchandise, I sell medical devices, I sell over-the-counter medications and hygiene products as well. I also have comments and consultations that I can help with, advice that I can help with. If you have any questions, just leave them in the comment section. I can contact you directly or help or answer your questions that way. So this video is called Allergy Season, What to Expect. Okay, allergy season usually comes in the spring when the flowers are blooming, typically when pollen is in the air. It occurs when the grasses are growing and the weeds are growing very high and the wind is carrying all of that material here and there. So allergy season is approaching us, and that's why I wanted to do this tutorial or this video sequence about allergy, because it's very serious and it can be life-threatening. Life or death is a part of the allergy season, especially if you're prone to allergies. Sometimes patients grow out of allergy type related situations in adulthood, but some people do carry on allergies throughout their adult life, and so it is a topic of discussion. Now, some symptoms can vary. It can be a headache, it could be sinus pressure, it could be sinus pressure here along the nares, it could be or nasal passages, it could be mucus buildup, it could be congestion, it could be lung congestion, it could be an itchy rash on the skin due to contact with a particular allergen or some sort of outside material could get on the clothes, and then the clothes could rub onto the skin and cause that type of irritation or rash or allergy reaction. And then there's also swelling in the throat. Could be swelling of the nasal passages and the throats. So allergy comes in different forms. It causes different reactions per individual. It's an individual type disease state, also known as anaphylaxis. Anaphylaxis is a body's response to allergens, usually during the spring season. Okay, and also things that exacerbate or cause the body to react. It could be also indoor allergens do occur, which could be dust, it could be dust mites, it could be insects, it could be roaches. Roaches are they seem to have an effect on asthma exacerbation as well. So do be aware of that. And to prepare for allergy season, I would recommend as a healthcare provider that all patients have their inhalers on board, have all prescriptions filled regularly, have over-the-counter or prescription medications for particularly allergy on board and ready, and carry those items with you when you're traveling. Carry those items with you when you're not at home, so that if an episode does occur, you have those materials with you. Okay, so allergy is a body's response to an outside source that gets past the mucous membrane. It gets past the mucous membrane into the bloodstream. The bloodstream immune system detects that this item is not a local item. This item is a foreign item. Let's get rid of it. So in order to get rid of the item, the body responds by swelling, inflammation, runniness of the eyes, runniness of the nares or the nose, salivation. It could be swelling, it could be headache, increased temperature, body temperature. So the body responds different ways, but mainly it's going to respond with the allergy reaction. That means your immune system is working overload to get rid of that foreign item that has entered the body, whether it be, again, dust, it could be grasses, it could be pollen, it could be the scent of insects that may be around. It could be anything that the body the text is going to get rid of. Okay, and that's how the anaphylaxis reaction is going to occur. Now, there are medications that are particularly manufactured and indicated of FDA approved for allergy season. Okay, now I want to talk about, before I get into treatment, I want to talk about, I talked about symptoms. There is also an allergy examination or allergy test that you can have performed for you in particularly at your doctor's office. Speak to your primary care provider to make sure that you are able to take the allergy test, and that test is going to help find out if you are allergic to anything, whether it's seafood, where it is pollen, whether it's just seasonal, or if it's any type of food product, a cosmetic product. That allergy test is going to rule out and going to pinpoint what you may be allergic to. Okay. Now, treatments can be treatments that help to go different pathways. It goes different pathways. Treatment goes different pathways to help avoid or help the allergen to get to the immune system to help calm it down. Although it's trying to fight off the allergen, the treatment that you receive is going to help the immune system to calm down so that the allergy reaction cannot cause the irritation and so forth. So treatment is going to consist of usually medications, active ingredients. These are active FDA approved ingredients. These are not vitamins. These are not dietary supplements. These are FDA approved ingredients, and they've been out on the market for decades and years and years. And those ingredients can include medications like antihistamine class, medications like expectorants or mucus reducers, also cough suppressants, also medications that help with rash that could be applied topically, whether ointment, salve, or some sort of cream item or cooling salve. Those medications are typically what you're going to see over the counter or prescription. And then there are also liquids such as eye drops to help with conjunctivitis or redness of the eyeballs or redness of the eyelids. Then you're going to see medications that can not only topical and are liquid, but you may see medications that are for the nasal sprays or ointments that can be applied in the nares or in the conjunctivitis areas to help rid of those such symptoms. Okay, you have codeine. Codeine is usually prescribed. It is prescribed, and it helps with cough. You'll see it in cough syrups that may be prescribed. Cough syrups such as Polytussin, things like that. Clotus, those type medications, and then you'll see expectorants such as guaifenesin. Guaifenesin is an expectorant. It helps to reduce the mucus that might build up, help that mucus to actually it helps that mucus to actually disintegrate, and helps you to cough it up so that you don't have that congestion in the nares or in the throat or lung area. Now, patients who have emphysema or COPD, patients who have asthma, they might benefit from guaifenesin as well to help with breathing. So do be aware of that. Dextromethorphan is also for cough suppressant as well. Diphenhydramine is an antihistamine. It helps to reduce the molecules, the immune system's molecules that causes redness and inflammation, puffiness, swelling, that anaphylaxis feeling that may occur. The body can take diphenhydramine, and diphenhydramine will, within a few minutes, can help bring all of that down. Diphenhydramine is also Benadryl. Benadryl, we're all familiar with Benadryl. Claritin is also an antihistamine. Loratadine is also a histamine. That's your Claritin, and that's your Zyrtec. Okay, and then you have the Benadryl as well. Another antihistamine class is class 4, and that's going to be your Allegra. Allegra is also a fast-acting antihistamine. It acts very fast, and it doesn't. It works a little bit better than the diphenhydramine or Benadryl because it does not cause that sleepiness or drowsiness side effect. Again, Allegra does not cause that side effect of sleepiness or drowsiness, and it is a little bit expensive. It's a little bit more expensive than the regular Benadryl because of that benefit, but it is at a discount price, and it's affordable, and it's out there. And then there are nasal sprays as well. They help open the nares. They come at reasonable prices as well. Those are also nasal decongestants like the pseudoephedrine, like the phenylephrine. Those medications are uh, they open up the bloodstream. They cause the opening of the bloodstream so that blood can no, they don't. They constrict the bloodstream so that the the redness and the swelling can go down, and then you can breathe. Okay, but when the arteries open up, that blood gets to flowing fast and fast, and you can't breathe because the it's just so the blood is just flowing so much. So the phenylephrine, pseudoephedrine, the nasal decongestants that you spray in your nose, they're going to constrict those blood vessels so that you can have an easier flow and breathing. Okay, that's what they're for. And then also, I went over the antihistamines, pseudoephedrines, the antihistamine, Benadryls, all those. Then there's inhalers. Inhalers are good for asthma treatment, emphysema treatment. We have the muscarinic blockers. You have the beta 2 blockers in those inhalers, and they open up the airway in the lungs to help with breathing, and that's what they are for. So if you are an asthma patient, then you already know what I'm talking about. But if you're new to asthma, or new to emphysema or COPD, or new to allergy season, your doctor may prescribe an inhaler with the beta 2 or muscarinic antagonist to help with breathing and open up those airways. Okay. And there's also powder inhalers as well for more severe conditions and maybe lung obstruction. So we hope it doesn't go that far, but you may be experiencing inhalers as well. Okay. Then also, in order to, I think that's all of the treatments that I wanted to mention. Okay, inhalers, antihistamines, nasal decongestants, creams, ointments, cooling salves that are over the counter for poison ivy and for poison oak, for insect bites, because we know all of those are outdoors. So do be prepared when you're traveling outdoors, when you're camping, when you're do make sure that you have adequate ointments on board. Okay. Um, and first aid kits in your first aid kits as well. So since I've gone over the actual medications and what anaphylaxis is, there's also epinephrine. Epinephrine is a medication injectable into the muscle that helps with anaphylaxis. It helps it works very fast. It helps to reduce the immune system's response to allergens. It works quickly, and there's a demonstration that comes with the manufacturer's pamphlet that comes with the 2 injectable count box, usually 2 injectables per box. The manufacturer's label and the box itself is going to help give you a demonstration on how to quickly activate the system so that it can work very fast, because anaphylaxis is time dependent. Time dependent. And anaphylaxis, swelling of the tongue and the throat, that's time dependent. And as fast as as a person can, the epinephrine needs to be injected in order to avoid any serious cascading of events. Okay, so epinephrine is only good for anaphylaxis emergency cases. Okay, if you are prone to allergy season, keep epinephrine with you. If you know what I'm talking about, then please leave a comment and let me know. It's very serious. Okay. To avoid allergies and allergy season, I would recommend, again, to have all your prescription and your over-the-counter medications with you at all times. First aid kits, epinephrine as well. Make sure that you have an allergy test performed. If you are prone to allergy or don't know which allergy you are prone to or would like to know for your own benefit, let your doctor or medical healthcare provider run the test for you and learn more about yourself in that manner. So again, I'm Dr. Erica, and I'm a pharmd for close to 10 years now. And if you have any questions or comments, please let me know in the comments section, and I'll be happy to get back with you with any answers that I could provide. All right, so thank you for joining me, and I hope to see you on the next video. Thank you. Bye-bye.